Okay, everyone, my name is Colleen Obeas, it's 11:39, and unfortunately, we have not met quorum for today's meeting, but we will have a couple of updates. We do have a new member, so we're gonna go ahead and take that into consideration, that you all did make it and you all have to get back to work or have other things to do. So we do appreciate you coming through. Very special thank you to Gerardo for providing lunch. I will pass out a quick sign-up sheet if anyone is interested in providing lunch for any of the future meetings. I did have scheduled all the way till, I believe, March. So if you happen to be able to provide lunch, we will definitely take that into consideration, and you're more than welcome to bring us lunch. And again, thank you again, Gerardo, for bringing us Chick-fil-A. So thank you, and ice cold water. Carolina, do you want to introduce yourself? So sorry. So sorry.
Sorry, I was very hungry. I'm Carolina Brasti. I work for the Senator's Office, here the district office. My title is Constituent Liaison. So I was appointed by Minister Cigarroa. So if y'all ever need anything, I'm open to collaborating or providing any letters. Usually we do it for, I think we did it for your office. But yes, anything we can provide, I'm open to it. And we also have a legislative aide, William Montemayor. He covers more of a health topic, so he's also available to our office and we don't need.
And you said your title is Constituent Liaison? Awesome. Thank you so much. Thank you and welcome. We have maybe some familiar faces, but not so familiar faces. So if you don't mind introducing yourselves.
No.
Oh, you're good.
My name is Kenneth Flores. I work with Border Region CAPS, work in the children's area, and I am for coordination. So I help the family try to find resources here in Laredo, food pantries, drug donations, even with the district as well.
Thank you so much and welcome.
Catalina Agüero, also Border Region, with the Substance Use Program, and I'm an LCDCI.
Thank you so much, and thank you for making time to be out here. We also are going to have a very new familiar face. We're sad to let Maria go. She, as a couple of months ago or a couple of weeks ago, she had gotten a promotion, but we do now have somebody who is going to be supporting, who is going to be staff support for the DAC. And it's Angie. Angie, do you want to introduce yourself?
Yes, I'm Erika Flores from Normandy, Angie. I'm the new administrative assistant here at the if anything, if I can help you in any way. Yes.
Thank you. And then we have some obvious familiar faces, but if you don't mind just introducing yourself to those who are new and to Carolina as well.
Hello, Linda Llanos. I work with Tropical Texas Behavioral Health, specifically the OSAR program.
Esmeralda Suarez from Bethany House, Street Outreach Program.
Gracias. Gerardo, do you want to introduce yourself?
Gerardo, business.
Thank you. And so I'm Colleen Obeas. I'm the Executive Director for Laredo Crime Stoppers.
I'm Earl Medina. I'm the DAC Secretary, but I also represent District 5 and President and Founder for Rio Laredo Youth and Safe Haven.
My name is Erica Lopez with the City of Laredo Health Department.
My name is Richard Chamberlain, Dr. Chamberlain, Health Director of the City of Laredo.
Thank you again. I can't stress it. I appreciate you all having to make time to be here and to be here. We are going to look closely in the future with regards to attendance and whether this day still is the right time to meet. If not, we're going to change it. I'm very happy to announce that Freddie is here because Freddie may have had a problem with coming into this day, but he's made these dates, so I appreciate you making the arrangements. But we will go ahead and take that into consideration because now we see that there are more people.
I'm here.
That we have more people not in attendance, and we definitely don't want to take from anyone's time. Everyone's time is very precious as we are all volunteering, but have that common mission to be able to support this commission. Dr. Chamberlain, I see that there are some announcements. Did you want to make announcements, or were there any announcements?
I mean, if everybody's okay, I can start off.
Yes.
Yeah.
Okay, awesome. So I wanted to share that on Friday, I got an amazing email communication from SAMHSA. And this was telling us that the City of Laredo was awarded the City of Laredo Drug Court-Based Substance Use Treatment Program. So this was applied for back in February of this year with the help of Ms. Erica and at the time Guillermo Walls, who was here with you all often, pushed this through And we were just waiting to hear some good news. Ultimately, this was provided to us on Friday. We're working through some logistical issues, but this should go on to council the first council meeting of October. So that way we can approve the budget allocation and of course the new positions that come along with it, which of course will be underneath the direction of Miss Erica, which goes symbiotically with the program that she has right now with AOT, with the severe mental health side of it. Now we have the component of the substance use to come hand in hand, walk them through the same process, diverting them from the court system into treatment, which is where they should be and not end up in jail. So this is definitely a win. Of course, we didn't want to overshoot it. We started off with 300 participants. We know that there's probably way more, but we want to demonstrate the value and the commitment we have out of the community. So as this project will be for the next 5 years, if there's any potential for a renewal or an additional application that we can go through to continue to have this type of program in the community, it's going to be a win. And we're definitely going to demonstrate the value for the patient and for the community from the services that are provided here and the evaluator that's involved and the data tracking, cataloging, et cetera. So we're very, very excited to announce that this has been awarded to the city of Laredo. It will be working in direct conjunction with Roots Recovery Center, our detoxification center. As in the agenda item, it was mentioned that it was for Roots Recovery Center, but the way it was written out, it's all for the Laredo Health Department and just is a symbiont to what we're already doing. As Erica had many hurdles and barriers to overcome for the AOT program, but we did it. We have patients coming through now, and since we know how the system works, we're going to be able to get this started ASAP. So this is definitely a win for us, and we're extremely excited.
Congratulations on that.
Thank you. It's us listening, but most importantly, understanding what the community needs. I did want to remind everybody that tomorrow, if you're available, please come hang out with us. We have over 20 organizations, school districts, of course, our CBOs that are here, ourselves, government, DEA, as many different organizations that can be present. We've heard that they'll be here tomorrow. And it's more for us to not really divulge into the data anymore. It's about action items. As I have there, prevention, awareness, strategy, what we can do. Maybe there's somebody who just hasn't spoke up in those moments because it tends to be, a handful of us that speak often, that you might have that great idea that can make that small change within a population of 10, 15, 20, 100, but that's still a change because we're saving a life. One life lost is one life too many. And we're very hopeful that tomorrow is the first of many think tanks that we'll be hosting via the City of Laredo Health Department. Tomorrow will be in person, and then we're going to make it more accessible via virtual realms going forward, and then have at least one every year in person so that we can come back in and have this water fountain talk, as it's mentioned, stopping by the water fountain to get that people person to person interaction. So we're very excited about that. I don't know if everybody had the opportunity to follow us at council. I did provide an update at the last council meeting. Give me a second. And I just wanted to share the same presentation that was provided to council, which was not City of Laredo. This doesn't have our logo on it. This is the City of Laredo as a whole and the overdose opioid response that we're all playing as a member of the community. Of course, just gave the stats. I'm pretty sure we're all familiar with them by now. We still are not, we're still trending upwards. We want to make sure to start coming back down. And we're not going to see that for this year because we've already surpassed last year's total. And as you can see here, the large majority of these deaths are male. Just breaking this down a little bit further into the age demographics, as you can see, the vast majority of these unfortunate losses are between in the 20s to 40. This is by substance. This is new information that the police department, I'm asking them to do just a little bit better on tracking on this information. It does take some time in the moment. Say for instance, it's cocaine or now fentanyl, they do have the test strips and they are cataloging it now into their report. But for some, where there's nothing around, we do have to wait till toxicology comes back, and that can take quite a while. And then that information is updated. So I'm still feeling that since there's a large number of unknowns, as you can see, that we'll still see the number of fentanyl and heroin numbers go up, which is unfortunate. But now that we do know we have a lot more access to Narcan in our community, that should help prevent these additional deaths as long as we have that education outreach going out to them. So we have seen an increase in the number of calls from 2022 to 2023. And unfortunately, we still have 3 more months left to go in this year. These are stats broken down by the zip code. Just to let this commission know, I've requested to have this GIS mapped. I'm sharing that with the commission. We can't share that information publicly because it is protected health information, that you did have an overdose at your specific address, because that is in your medical file. But for us, for intervention purposes at the city level, we'll then put together a 5x5 block. And that's what we'll say, we need to concentrate efforts here with your organization, our outreach, police, DEA intervention. I know that they have that, but they have that information in the law enforcement area for the enforcement side, where the drug dealers are. And so we want to know how we help the users as well, because it is that cycle that we're trying to break, and get them access to Narcan and let them know how to use it. And also for the persons that are around, the family and friends as well. You can see here that there are 3 specific zip codes that do experience the higher numbers of overdose deaths in our community, which is 78046, 78041, and 78040. And so that's where we want to target, but that was at the zip code level. We're gonna GIS map their addresses, where exactly they happen, so that way we can have that targeted intervention.
And that is actually fantastic. You had 78076. Where? Okay, that's what I was trying to figure out. Okay, great. Thank you.
This is data, of course, that's now up on a dashboard that is provided by DSHS, Texas Department of State Health Services, and just demonstrating. I mean, you look at fentanyl poisoning deaths in 2016, 130 to 2022, significant increase. That's like 2,000% increase, very concerning. And then for 2023, when this data was produced, if I'm not mistaken, I had snapped it. This was up through June. And 43% of all the deaths now in Texas that are associated with overdose are associated with fentanyl, specifically synthetic fentanyl, right? Because there is pharmaceutical grade fentanyl that is used in medical procedures, but that's not what is out on the streets. And this just gave a little bit of background as to what's going on. The Roots Recovery Center, I know Dr. Martinez isn't here right now. They're actually going through the licensing process right now. They're going through the licensing process, but then there was this video that started playing. So I'll just jump over to this so we can hear it very quick.
Last time I came, I taking two Narcans. It helped out in a very critical situation. My friend was dying in the backseat of the car from overdose of fentanyl. So both of them had to go in his nose. First did the first one, put him out the car, did the first one, throw him on the side. It worked, so I injected another one. Then he came back after probably 2 minutes.
David Walker tells us about his experience with Narcan, an over-the-counter medication used for the emergency treatment of a suspected opioid overdose.
Yeah, with the Narcan, I have experience with it because a lot of people in here actually overdose a lot. So when I see you, I try to be more like not like to hear about it. So at least help them a little bit.
David comes to Bethany House to get meals and resources, but today he got the surprise from the Laredo Fire Department as they were educating everyone on the use of the medication.
I think they're helping a lot, actually. They're helping a lot. What's for them, I guess we wouldn't really have the Narcan.
This particular project, we're out going to the community and giving Narcan awareness and training to people in need, because there's been a steady rise in cases of overdoses.
In fact, the Laredo Police Department is reporting 45 overdose deaths in our community and counting, an alarming number that prompted the quick response from the Laredo Fire Department to prevent more cases from happening.
It's intranasal, and it's very easy to use, and we try to teach them that it's very safe and effective, and it's another life-saving medication to combat this crisis.
And so this was also demonstrated at the council level for the community to see that this is one of the responses that is ongoing within the city infrastructure, but in the city of Laredo as well. As I was mentioning with Roots Recovery Center, they're going through the licensing process. We are very hopeful that everybody receives an invitation to the ribbon cutting of the facility by the end of next month, which is a significant win as we're starting off this new program that we have, but then for the much needed service that's been absent from the community for decades will now be back in service. So we're excited to have that. And then just as I mentioned, this isn't the city of Laredo, this is the overdose campaign where all organizations are under this umbrella and able to use this, this logo, this seal for our purpose. I mean, that's the whole purpose of having a logo that is for every organization. Just highlighting that this was started in November 22, and we've had several meetings after that. Then the partnerships that we have with all the different organizations, which is not limited to, which is shown on the screen, Pillar Scan now, Border Region, Crime Stoppers, LIC, UIC, My Purpose, DEA, and there's so many more, demoing that this is how we get it done through the partnerships. We did have that one Pill Can Kill town hall, which was organized by DEA, which was good to see and have that presence of DEA, not just on the enforcement side, but in the communities, and, you know, doing education and outreach by them, which is definitely a win. The overdose prevention proclamation, which thank you to Ms. Marina for pushing that through and bringing in all the different organizations to come together as well. The run, which is another success to bring even more awareness to the overdose prevention awareness. And then for us, going back to the city of Laredo, we wanted to piggyback off of what Pillar is doing with their vending machines, or harm reduction vending machines. So we at the city of Laredo, as you can see, there's cabinets and then there's dispensers, which are both of those down there. So those cabinets and dispensers, we have ordered 7, and we're going to be putting them in those locations when we have the GIS done by the end of this week. So I know that Pillar has, you know, condoms and hygiene kits, which is awesome, but this will just be accessible for anybody in those areas, whether it is a user or a family member, that these will be readily available, and we will be restocking them through the health department with the support of our big brother, big sister, UT Health out of Austin, as we have made that connection with them. But these were purchased in response to what we're observing and knowing that Pillar is doing work, we need to do work, we all need to do work to have more access to Narcan, naloxone, especially in those areas that are of need in the community.
I have a question. Are these gonna be inside or outside?
The cabinets will be outside, since those you have to like unlock, but it'll have like it's a lock, it's not an actual key, so you just turn it. So they'll be outside, they're available. And the other, since it's just an open receptacle, when they drop and you pull them out, those would be inside a facility that we're gonna identify on city property.
And these are good regardless of how hot Laredo is?
That's why we're leaning more towards inside. We'll probably just have a few outside, because we don't want them to become ineffective in their moment. If I'm not mistaken, the threshold for them can get up to 102 degrees, and then they're rendered no longer effective. So that's why we're starting it off towards the end of the year.
Yeah, when it's
It'll be a lot cooler, and in the shaded area, and we're gonna revisit the cabinet time the cabinet refill in March of next year, and just probably stick with the dispensers that are inside the recreation center that are right there in the front where nobody's gonna judge you for walking in and just pulling out a couple and leaving. So this will be accessible by the end of this month, which we're excited to get started. With that, we're gonna push out this video, which is, I think it's about a minute and a half. That'll be shared on social media. Just letting everybody know how easy it is to use Narcan. So you don't need to be officially trained. You can watch this YouTube video and know how to use it.
A person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open the Narcan nasal spray blister pack. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently
And so, whoops, that was an accident. I don't know why it timed out, but that's what we'll be showing to members of the community to make sure that they know that it's easy to use and that you can save a life. And then lastly, it's just what was shared was the monthly think tank that will be happening tomorrow. Again, you're more than welcome to join us. The more collective minds we have to be able to produce action items on prevention, awareness, and strategy is just going to be a win for the members of our community. And with that, I'll probably talk more.
Well, thank you so much for this very worthy information, because it is, like you mentioned, a big win for our community. So I do want to give him and the Laredo Health a round of applause for all their hard work. Because they're definitely making an impact, and it's very long overdue. And I think you mentioned it's been over a decade since we started thinking and talking about the detox facility, and now it's coming to fruition. So we're very excited about that, and hopefully we'll be able to celebrate that opening in October. We were trying to do August, right, because it was an awareness month, but October is also an awareness month. And in spite of the fact that we have awareness months, these efforts don't just stop during that month. We continue to do the best that we can do through our organizations or through the resources that we have. So again, I can't stress it. Thank you very much for doing what you know how to do and sharing that information. And on top of that, everyone who is here has an impact of one way, shape, or form of making a difference in keeping our community healthier, safer, and better. So we do want to make our community a safer place to live, learn, and play. And through our organizations and through our efforts, we're making that. So thank you very much. Erica, did you want to share anything by any chance?
No, it was just that news.
All right. Is there anybody here, any of the stakeholders?
I was thinking about the pizza and I was like, I don't know if we can.
Well, it's great information, and I think knowing where the overdoses are happening will definitely target. I know that I do in the future want to bring in Lieutenant Montemayor, who is the lead coordinator for Crime Stoppers. When we do specific campaigns around these specific area codes, or that we do a raid based on Crime Stoppers tip, it slows down the overdoses, and it slows down the sale of drugs in that community. So what I'm looking for is more money to put out more campaigns, because it's just simply if you see something, say something, report it to Crime Stoppers, and you're eligible for a cash reward. People are looking for that cash reward because one, they're tired of what's going on in their community, in that neighborhood, and two, they want to put a stop to it before it affects their close family and friends. We've seen that, and I know that Lieutenant Montemayor had mentioned it at my last meeting, and I said, I need to get you into the DAC meeting so that you can report that information. In turn, that's why we want the stakeholders here and anybody who is a part of the DAC to be able to report the success of the different efforts that you're doing. Does Border Region have anything that you all want to share, or anything that's happening?
No, the same as last time, just that we moved to, West Village, 315 West Village, Suite 112, we're taking all those.
Thank you very much. And it's very important, I think, we were working on the resource directory. We're gonna update that hopefully in collaboration with, the overdose campaign and knowing who's available to provide these resources. Freddie, do you have anything that you wanna share on your end?
Yeah, just recently we got word that, that we were applying for the juvenile drug court and we were just recently awarded for that. So I'm working with, I believe we're gonna be working with Pillar, I believe, and we're excited to get that off its feet. I didn't want to steal anybody's thunder, but it's with the juvenile drug court, so we're excited to implement that with Judge Belahan.
Okay.
In conjunction with the DWI court, so I'm excited to kind of see how we can incorporate that into what we're doing here. So I'm excited to see where that's gonna take us.
That's awesome.
Yeah.
Congrats on that. I mean, the more awards, the millions of dollars that are brought into the community is something that needs to be shouted. We need to be loud about it.
Correct.
So the community does know that we are truly listening but understanding the need that is here in Laredo. So we're excited.
Do y'all want to share anything else on that line?
Sí, yo tengo el agency outreach. It's gonna be on the 22 from 10 to 12, Jarvis Plaza. It'll be this for the next following.
Can you briefly explain what the community outreach consists of?
Sí,
En inglés o en español, como tú quieras.
Sí, los agency outreach yo los empecé a hacer porque cuando entré a trabajar en Bethany House yo no conocía a nadie. Entonces yo decía, ¿cómo voy a llegarle a mi gente si no sé cómo se corre la calle? ¿Qué está pasando? Entonces yo empecé a salir a la calle. En ese tiempo no teníamos todavía uniformes. Iba y miraba a los muchachos que se tiraban ahí mismo. La plaza estaba llena en Jarvis Plaza. Y de repente empecé a hablarles por su nombre. Y ellos se quedaban como, ¿cómo sabes mi nombre? Entonces ya después ellos me empezaron a agarrar confianza. Y ya me empecé a introducir. Les dije, mira, yo trabajo en Bethany House. Tenemos estos servicios. Ofrecemos el shelter, pero si quieres te puedo ayudar a contactarte con personas para irte a detox. Tenemos que hacer un plan. Primero tenemos que desintoxicarte, después que regreses a ganarte casa, a ponerte a trabajar para que te vuelvas a integrar a la sociedad. Entonces, tuve mucho éxito, gracias a Dios, que me dio el favor y la gracia de llegarle a las personas. Entonces yo iba sola a esos eventos, yo iba sola, yo iba y me sentaba, llevaba mi hielera, llevaba todos mis flyers, mis folletos, y simplemente el hecho de tomarte el tiempo, ir a escucharlos, esa es la clave. Ahí empecé a tener muy buena reacción de la gente, de mi gente, yo les digo mi gente, mis muchachos, muchachas. Entonces ellos mismos se me acercaban y luego ya iban y me buscaban a Bethany House. Y conforme fueron pasando los meses y agencias se me fueron juntando, sabes que yo quiero ir contigo, Esmeralda, ¿a qué podemos llevar? Y ya les decía, no, pues lleven mesas, lleven sillas, llévense cualquier cosa que su agencia les vaya a funcionar. Y así empecé yo este programa para información para ellos, para mi gente. Y gracias a Dios las agencias me respondieron muy bien y ahorita nos juntamos bastantes en la Jarvis Plaza. Acabando el agency meeting the following week, siempre hago, ese es el agency outreach, hago un agency meeting donde nos juntamos todos y hacemos bring up cases que tenemos hard cases, que no sabemos para dónde moverlos, introdujimos programas, qué es lo que hay disponible en la comunidad, a dónde los podemos dirigir para darles un movimiento y no se queden como un caso más. No, ese caso se trae a la mesa, se empieza a discutir, empezamos a tener opciones y poquito a poquito los vamos moviendo. Entonces, ha tenido mucho éxito las dos cosas. Yo lo hago con todo mi amor y la razón que yo llegué a Bethany House fue hacer una misión y gracias a Dios se ha estado haciendo. y la gente ha respondido muy bien, tanto como las agencias. Okay. So, esos eventos los hago casi siempre la tercera semana, el Agency Outreach y luego el Agency Meeting, para estar todos on the same page, estar todos aware de los programs, de dónde los podemos mover, qué hay nuevo, entrenamientos, y pues nos hacemos saber que ahí estamos afuera para ellos. Básicamente es lo que hago.
Muchas gracias por la invitación.
Sí.
Esos anuncios se pueden poner en el chat.
Sí, las puedo poner.
Sí, porque no sé, pero nosotros tenemos una agencia con HHS y HHS pues trabaja con varias agencias. Y a veces esas agencias tienen servicios, ¿verdad? Pero a veces no son aquí en Laredo, pero pues de algo se puede servir. Lo único es de que ellos necesitarían que hablarme a mí directamente. No lo puedo usar como, pues escuché este caso, ¿le puedes ayudar? So it would be direct from the individual. So that's how we can help in our office.
Sí.
So, cualquier servicio que no cubre, ellos pueden ver, a ver cómo le pueden ayudar en otras formas.
Perfecto.
Pero sí,
¿El agency meeting cuándo es?
El agency meeting este mes lo iba a hacer, este mes no lo voy a poder llevar a cabo por la razón de que tenemos un entrenamiento en Austin.
So, para la próxima, el mes que entra, si los avisas, eso es a lo mejor donde ella puede asistir para ayudar en esos casos.
En el agency meeting se asiste mucha gente. Tenemos a Little Lay, tenemos a Miss Mendiola, Scan, Border Region, Pillar, son consulado mexicano. Estamos trabajando también con el consulado mexicano. De hecho, me hicieron certified para repartir información a la comunidad de los servicios que ellos dan ahí. Hace poquito me gradué de ahí también, porque sí nos cae mucha gente que está adicta a drogas y no tiene documentos. Entonces, una vez entró un muchacho y me dijo a mí, ¿y nosotros qué, mis Suárez? Nosotros también tenemos adicciones. They're right, o sea, ellos también tienen adicciones. Entonces, esa fue la manera que yo dije, ¿sabes qué? Tengo que meterme más al consulado para que les ayuden a tramitar un ID, algo consular, una identificación para que los acepten either en methadone o un substance abuse program. Esa fue la razón también de que está el consulado también con nosotros, y ya cuando nos metimos a las clases, pues nos dimos cuenta de todos los programas que maneja el consulado también. El consulado también va allí. Miss Lani, ella es de Legal Age, ella es bien linda, Miss Lani. Pues ahí básicamente tengo muchos contactos ahí en las juntas. Pero claro que sí.
Para la próxima, para que sí lo puedas poner en el chat o mandarnos un correo electrónico y podemos...
Básicamente hago la invitación por correo y luego se las mando. Es como...
If you want to just give her your information, you can do that as well.
Sí.
Muchas gracias, Esmeralda. Ms. Linda, do you have any updates or anything?
No updates, but just so that you all know a little bit more about OSAR. So typically what I do is we do screenings and evaluations on youth 13 and up, anyone who's looking for substance use services. I have been working a little bit more with the juvenile. So anybody who tests positive, they'll go ahead and refer them to me and I'll evaluate, what their use is like. Typically I'll get more calls for detox than for residential treatment, but we always try to recommend residential, the process. You wanna go to detox, we do recommend residential, and then after that, aftercare, outpatient services. So we kind of guide them with the referrals and other resources.
She's really good. Yo trabajo mucho con bastantes porque si me llega un muchacho, ¿sabes qué? Me quiero desintoxicar, un ejemplo. Me quiero desintoxicar, ya no aguanto. Yo le doy mi contacto, Miss Lena, mira, aquí tengo esta persona, aquí la voy a asesorar, no la voy a soltar, aquí le voy a pasar el teléfono hasta que ya tengamos listo, ¿verdad? Ella le hace un assessment, le consigue los boletos y hasta que no me da la información, aquí está tu boleto, te vas a ir, les proveemos ropa y todo para que ellos se vayan. Es básicamente cuando ya vienen los muchachos hacia mí, no los suelto hasta que no los trabajo, hasta que no acabo, o sea, muchos ahorita ya los hemos hecho house, muchos, sí he oído críticas porque muchos me dicen, ¿cómo les vas a dar casa o sea, como yo no les doy casa, ¿verdad? Yo los refiero a los programas y hago el procedimiento, pero sí los refiero a housing. ¿Por qué? Porque eso también es una manera como de presionar un poquito, ¿sabes? Que mira, tienes housing, lo tienes que cuidar, tienes que portarte bien, no vayas a recaer o así, porque tienes, o sea, es un modo también de educarlos. Cada persona es una historia y detrás de cada historia está su raíz. Siempre lo he dicho, llegamos a la raíz, le podemos dar el seguimiento como debe de ser.
Thank you for that comment, and that information. Gerardo, do you have anything that you want to share, any comments?
It's all about the resources, accessible resources, funding and all that stuff. Laredo, unfortunately, as you all well know, we're always 20 years behind, and it's becoming less and less. Corpus has had great programs for the last 30 years, San Antonio, Austin, but I think Laredo's really kicking ass.
Thank you.
You got
That's
us.
us.
Yeah.
Thank you.
Yeah, it's really, I mean, it's new for us and all the resources and the networking and all that. But, I work with a lot of people outside of Texas, other states. And it's just, the resources are there, and detox is great. But if you don't follow up with intensive residential, outpatient, all of those other things, you will have a revolving door. And you probably already kind of learned about that, you can just have people just doing this. And they start using the detox just so they can, clean up for a little while, especially the heroin addicts. But if we have the resources and the teams to work with these people, the odds go way up.
Well, thank you for that comment. And again, everybody's doing a great job, and it's better late than never, right? So it's coming and we're doing, and it's a blessing to be able to get these resources and now to be able to get them out into the community and educate them. I know that they are having a National Night Out on October 4th. There will be a press conference later on this month. But if through the agencies you all want to participate, I would recommend that you all reach out to the Laredo Police Department's